Hey, happy Friday. Welcome back to Library at Sherry. And it is so nice today because it is raining outside at my place and I don't have to go out today, so it just make it extra amazing for me. I don't know if you have to go out to work today. If so, I'm sorry. But anyhow, let's start with the last part of the Season 1 House MD laboratory content explanation. Wow, that is really long sentence. But anyhow, last week we finished at the episode 15, so continuing on, this week gonna be in between episode 16 all the way to the finale, episode 22. The last one-third part of the House MD in the first season spent quite a bit of the time on talking about hospital politics and some love scenes. It didn't have like as much of laboratory content as the earlier two-third part of the season, but we still got something to talk to. The first one is in the episode 17. This is a patient has Epstein-Barr virus. The whole diagnosis process was shifting quite a bit from AIDS all the way to hairy cell leukemia. While they were at the stage of trying to figure out whether it is hairy cell leukemia or not, they got some very funny arguments going on.
The senator's breathing is severely impaired. His O2 sat levels are at 89. His silver stain indicates pneumocystis carinii pneumonia.
Another killer fungus. It's consistent with hairy cell leukemia.
But we can't biopsy his spleen. Respiratory distress, his platelets are 20 and dropping, his blood won't clot worth a damn.
There's got to be another way to diagnose hairy cell.
No, his bone marrow is indeterminate. Spleen biopsy is the only way to go.
As you can see in this scene, they are talking about doing a biopsy to finalize their diagnosis. If the patient is having hairy cell leukemia, and there are a couple routes they were considering about. One is spleen biopsy, another one is bone marrow. And they were talking about how the patient's condition is so bad that he won't be able to do a biopsy and the bone marrow is unsuitable for this kind of region, and that they are having a fight. Well, here's one thing I need to tell you. Do you know why hairy cell leukemia is called hairy cell leukemia? The answer is very simple. Because your lymphocyte having hairy plasma. And that's all the reason why it got this name. So no, if they just need some supporting evidence about whether he is having this type of leukemia, all they need is a few extra slides of blood smear and we will find all his lymphocytes in there and trying to figure out if they're having all those hairy specking out plasma. Well, they did mention this patient is having very, very extremely low white count, so it's not gonna be easy. But the fact is, there is nobody in the world will be circulating absolute zero white cells in their system. So as long as he got some, we'll be able to capture it. If one slice is not enough, we'll make 2 slides, we'll make 4 slides, as long as you tell us why you definitely need to know this and you really, really need a result. These things are something we frequently get calls from the floor and we can make adjustment based on the treatment team's requirements. Some very specific cases, they might just need extra slides to capture enough cells. If there is certain morphologies they are really, really interested to know and they are so important to their diagnosis, we will do absolute everything to figure it out. If you can just communicate. In this case, obviously, Dr. House is not a very great character for making communications with lab, but since he is running his own lab, I don't like that part, but since he's running his own lab, he can, do this part. But in the real life, if you having this type of leukemia, the hairy cell leukemia, and your doctor is looking at your extreme low white count and really need to know if you got the hairy cells, he will make a call to us and we'll figure it out. If it's not on the tech bench, it will be in the pathologist's office, but somebody will figure it out for you, so don't worry about it. This type of I can't figure it out situation is not going to happen to you. Next thing, we are jumping right into the episode 20. This is a osteomyelitis case. This patient got a huge collection of pus in his jaw, and that pus is breaking off some clot, causing him having strokes and all that. And in their whole diagnosis process, endocarditis was part of the suspicion. And that brings in one thing that makes me very unhappy about how they designed this case for display, because it's completely ignored the importance of blood work and laboratory. And let me show you the clip first.
Number one sign of fulminating osteomyelitis.
Infection of the jaw?
Infected tissue from the jaw breaks off, blocks blood flow to the brain.
It was hidden from the scans by the metal plate.
And an infection in the jaw is unlikely to show up in blood tests.
So how do we confirm?
Like this. Ladies and gentlemen, we have pus.
So Chase, our good-looking Dr. Chase, he is saying that osteomyelitis is not going to show up in the blood work. No, it will. So whenever you have an inflammation, even somebody may not have a significant spike of WBC, which is your white blood cells. Maybe you just the type that doesn't spike super high, it just slightly elevated and doesn't trigger alarm. But if somebody is being suspected to have some sort of inflammations, there are other tests you can do to see if the inflammation is bad. So first of all, since they was considering about endocarditis at one stage, the blood culture should have been done. And even that blood culture is not having a result from the incubation yet, or this patient is having non-bacterial inflammation, which means when he got this injury over here, he probably didn't have any open wound. It's non-bacterial inflammation. It's like your carpal tunnel. That's one of the sterile inflammation too. But if you do have inflammation, it doesn't matter where, it doesn't matter if it's bacterial or any other causes. There are two inflammation markers. They are non-specific. They will always going up. One of them is called CRP, and the other one is called ESR. The ESR is measuring how quickly your red blood cells are settling in a tube. CRP is just something released out by your liver. Just whenever you got an injury, you got an infection, that thing will just getting pumped out from your liver and will catch them in your serum or plasma. And this thing, because it's very non-specific, any injuries, any trauma, any infections, it will make it go up. And for this guy who obviously got a huge collection of pus in his jaw, the CRP is definitely going to be high. And if they just ran the test, they'll be knowing this guy is in some sort of inflammation. And if they did all the scan and found nothing besides that little metal plate in his jaw, they should have been looking at it. So yeah, don't skip this test. It is not specific, but it's useful at some point. When Chase saying, oh, the osteomyelitis is not going to show up in his blood work. Well, no, not directly, but it will show something. There's no specific blood work will be saying when you have this protein, you must be having osteomyelitis. But there is still blood work indirectly can reflect your inflammation status. That's something you actually can order. And it's a very quick test. It will give you a result within just a couple hours. Even if it's super high, we need to run a lot of dilutions, it's still something you can get a result really quick within one episode. In the very next episode, episode 21, Dr. House went to teach some students, so he brought up 3 cases. One of them is having myoglobinuria, which means you are peeing something looks reddish brown.
What's the differential diagnosis for urine that's tea-colored?
Kidney stone.
Kidney stones would cause what?
Blood in urine.
What color is your pee?
Yellow.
What color is your blood?
Red.
What colors did I use?
Red, yellow, and brown.
And brown. What causes brown? What are you missing?
Muscle death.
That reddish brown can also coming from the muscle damage. Guess what? This is also something showed up in the PITT series, both in season 1 and season 2. I can put the link down below if you want to go to see. It was one of my reaction series. Although I need to warn you right now, because I did that way before I did this Dr. House explanations. A lot of my videos, now when I'm looking back at myself, it's kind of awkward. But I still did a good job on explaining them. Don't worry about that part. You just probably have to suffer a little bit about my editing technique. Now, back to the topic. The reason why your skeletal muscle and your blood is showing red is because there is something called heme. This is a protein group that will hug on a iron atom and then give you that very nice red color. And because of that iron atom exists, this thing can be at the different oxidation stage, and that's why sometimes your blood looks a little darker, sometimes a little brighter, all that. But the point is, both your skeletal muscle and your blood, they share this group. So whenever you got those kind of reddish thing going on in your urine that's supposed to be yellow, that means there is heme group in there. But just by looking at the heme group, you won't be able to tell if they are coming from your blood or your muscle. The only way we can tell the difference in between whether it was coming from blood or if it's coming from your muscle is if we put the urine under the microscope and take a look at it. If we see the red cells existing, floating around, most likely it's coming from your red cells. And we will say you got hemoglobinuria, and it's most likely coming from your blood. And if we don't see any red cells under the scope, that's the time you have a higher suspicions on myoglobinuria. And the other case they mentioned over here is necrotizing fasciitis. That's not English. That's rooted from Greek and Latin. I definitely like the other name a lot better. It's called flesh eating. They're the same meaning. It means you got bacteria infection and your meat or your flesh is going bad. That's how simple it is. I don't like the neck flesh whatsoever.
The good news is, you might just live. The bad news is your doc's gonna die.
Harvest lot to save this thing?
I'll hold him. You swap him out. I got his head, just do it.
And first thing I need to clarify over here is the neck flesh or the flesh-eating disease or bacteria, it's not just one single bacteria. In the particular case they mentioned in Dr. House, this one, it is a streptococcus. They swabbed from the dog's mouth. I'll explain that part later. Again, that's another part I don't like about this thing. Strep is one of the common cause, but there is also other bacteria can do the same thing. Any bacteria that able to eat over your deep tissue and causing this kind of damage, they'll all be called as flesh-eating bacteria. Other examples are like MRSA, it can do it too. And also another one coming from the ocean, it's the Vibrio. MRSA is something coming from the Staphylococcus group, and Vibrio is a gram-negative bacilli. So it can be all kinds of different bacteria, not just Streptococcus. Anytime if you got an infection, the redness is developing so fast and your wound is not healing and you just visibly within few hours can see that redness is develop up, run to the hospital, just run. There is a chance it develop into a flesh-eating disease. This is a very symptomatic description. It has nothing to do with the specific organism that can cause this. There is a lot of them. And second of all, it's about swabbing the dog's mouth. What about you go swab the patient? Like sample the patient. They even mentioned in this show, the dog mouth is very dirty. Any animal's mouth is very dirty. So if you go to swab the dog's mouth, I can tell you right now what you're gonna find. You will find all kinds of bacteria under the scope. Every single kind you can imagine about. And one thing you will not know is which one is causing this patient's leg going bad and falling off. So go swab the patient, not the dog. But anyhow, this is also a case that PITT did a whole episode on too. It is on their season 2. So if you're interested, I'll put the link down below too. And I did got pretty emotional during that reaction series because I was screaming outside the screen about how they are not running some tests that can identify the bacteria way earlier before they had to cut the patient's whole leg off. So that's it. That's the last part of the season 1. Start from next week, we will go to season 2 of Dr. House. Yay! This is Lab Rat Sherry. See you next Friday.